Morning, folks. As far as human infections are confirmed microbiology class, the third microbiology class we have is limited edition. Let's go and check out what we have. Pseudomonas aeruginosa is from burns infection and underchlorinated water exists in distilled water, and it does not do not escape infection from CF patient, that is cystic fibrosis patient, chronic infection of cystic fibrosis patient. Wet form of Pseudomonas aeruginosa is the alginate positive. Alginate positive is wet mucoid appearance of colonies, and you get inhibition of phagocytosis, and the Burkholderia, pseudomali, abscess in organs and liver, spleen, and lungs, skin, superficial tissue, joints, and you have veteran war, tropical, subtropical, Southeast Asian, Australian, and it surface a year later after surviving in phagocytosis, rice paddy, northern Thailand, highly prevalent. The Burkholderia pseudomali is cytotoxic positive, 42 percentage. Stand for 2 degrees, like glucose and cellulose oxidizes. That all we have on Pseudomonas and Burkholderia pseudomali. The non-fermenting gram negative, basically also you have Moraxella catarrhalis oxidizes oxidize positive. Then highly sensitive to penicillin. You have extended spectrum. Then we go to extended spectrum beta lactam producing Klebsiella pneumonia and E. coli point mutation. They produce beta lactamase, hydrolysis, broad spectrum antibodies, cephalosporins, penicillin, and monobactams. Bubonic plagues infect swelling lymph nodes and axillary lymph nodes, Yersinia pestis, as well as airborne infection is lungs is caused by pneumonic plague. When in terms of E. coli and Salmonella Shigella species, you do serological test, and E. coli is orbital positive for O157 and flagellar antigen 7. Salmonella Shigella is orbital serology negative, and the E. coli present hemorrhagic colitis, bleeding mucosa. They are cross E. coli cross-react with Shigella and typing sera, whereas Salmonella Shigella or H2S positive colonies, black colonies. Then you have Proteus species, Mirabilis, from indole negative from is detected from UTI patients, and vulgaris is another species. You can find from 40 species we get a study about. We also deal with Salmonella. We back to Salmonella. Kaufman White scheme, you have Salmonella of somatic O, heat stable H. O somatic O is heat stable and H is heat labile, and V1 and K capsular polysaccharide is removed by heating. 22,000 species are found in Salmonella. Serratia marcescens is grown in diabetic patient, hospitalized patient, leg wound, and grow motile, lactose negative or Mekong agar. They are VP positive, and citrate negative. DNase gelatin is positive. Positive ornithine lysine decarbolase is positive. It's all. Then we have, what else we have, this quick study. This is the third microbiology class. We have this we have group E strep, you have direct hybridization method confirmation test for group E strep, and RT-PCR, you have viral meningitis enteroc virus is detected in the 5N locus, and you get methicillin resistant staph aureus from methicillin resistant coagulase negative staph by the OR of amplification PCR, and you have PCR detection is in case of tuberculosis, you get 98% positive for tuberculosis positive patient. In spite, preferably they should be culture positive and spear negative, who are answering less than 90% on PCR. Thank you for the class. We have one more. That is. I'll just, that is CSF study. Yeah, you get the fever of unknown origin. In case of CSF, is cause is hyperglycemia. The normal range is 40 to 70 milligram per deciliter, and more than 70% is high plasma. It is already positive in the plasma, 70% positive, glucose positive, the plasma, and that's all we got. Thank you.
कौसल्या सुप्र